Hi, my name is Nico Osborne, and today I will be covering hallucinogens. In this presentation, I will be going over the basics of hallucinogens, including the definition and examples of these types of drugs. We will also be covering why people choose to engage in these drugs and the effects it has on our bodies. Then we will cover the topic of marijuana, the growing trends of hallucinogen use, and a strange phenomena with LSD that I find to be pretty interesting. So starting off here, what are hallucinogens? Hallucinogens, commonly known as psychedelics, are drugs that have the purpose of changing a person's awareness of their surroundings, including thoughts and feelings. These drugs, both man-made and natural, work to create hallucinations, making those who use them feel apart from their bodies. Some of the most popular hallucinogens are LSD, ketamine, PCP, and ecstasy. Now that we know what hallucinogens are, we can talk about how they affect both our minds and bodies. Many people tend to use hallucinogens to relieve stress and improve their moods. Another common use is to change or improve how they might react to outside factors. Some people feel a calmness that may help with anger issues. Others may simply want to dilute what they feel capable of reacting to, almost like an anxiety medication. Altering the state of moods or brain activity also includes the trend of microdosing mushrooms, as many people tend to feel a boost of creativity or new ideas once they consume these drugs. Some use them to increase their appetite or even suppress it. While many people find benefits to this usage, with any drug, there are negative side effects. These side effects include an elevated heart rate, nausea, and in certain circumstances, overdosing. A lot of people tend to feel these as well when consuming marijuana. Colloquially, it is known as greening out. While these side effects aren't guaranteed, they can happen, which usually diverts a person to not engage in these substances. While marijuana commonly seems as if it's its own category of drug, it is a hallucinogenic. It does not always create the same effects that LSD or other hallucinogens do, but in high doses it has this possibility. While previously heavily scrutinized, its use both medically and recreationally is increasingly common. Many people tend to use this drug simply for pleasure, but there are medical benefits for it. Most commonly, medically, it is used to lessen the symptoms from chemotherapy treatments in cancer patients. It is also useful in treating chronic pain, including phantom limb pain and amputees. Concerning mental health, it can help reduce symptoms those with anxiety disorders or PTSD may experience. Due to these benefits, more and more states continue to legalize marijuana, either medically or recreationally. Currently, it is now legal in 39 states for medical use and 24 recreationally. Trends have shown the hallucinogenic use to consistently increase. In September of 2024, it was reported that this use has stayed historically high. Most people using these drugs are between 19 and 30 years old. In 2019, almost 5.5 million people were involved in the usage of hallucinogens. To the right, I have a graph from 2017 showing the hallucinogen use in high school students. While this graph only shows at least one usage per student, it is important to note how young children start to experiment with drugs. This information gives us what we need to see in order to educate our young population on the dangers of hallucinogens. Lastly here, I have a pretty strange and interesting phenomenon with hallucinogens, and this involves LSD. So an experiment was done to show this with flashbacks. In this experiment, 9.2% of healthy subjects experiencing this phenomenon on an average of 40 days after initially taking the drug. While there is no known reason of why this happens, there are a few hypotheses. In Table 2, we are able to see the specifics of some that experienced this. This information includes their age, gender, how much LSD was administered to them, and the symptoms they experienced. Again, while none of these demographics seem to be correlated quite yet, these types of experiments help us to better understand the drugs and how they could affect different people.